Getting pregnant involves both the man and the woman, and there are several reasons a woman might not be getting pregnant. So in this video, we are going to be looking at 22 possible reasons you are not getting pregnant. And this has to do with both the man and the woman, because of course, a quality sperm and a quality egg has to meet for pregnancy to happen. And there are several other factors that can prevent pregnancy from both the man's side and also from the woman's side. So if you think this is something that you love, then you consider watching this video to the very end. If this is your first time on this channel, consider subscribing right away and turning on notifications so you keep getting updates. And for my returning subscribers, thank you so much for coming back. Kindly hit the like button as you watch this video. That's going to help it get more visibility. Now, the first reason you might not be getting pregnant is because you're having too frequent sex or too little sex. So if you're having too much sex, it's going to result to exhaustion, fatigue, and even dehydration. And none of these are not going to favor you if you're trying to conceive. So having too much sex is detrimental to getting pregnant. And also, if you have too little sex, it's going to reduce your chances of getting pregnant. Because of course, the egg, when released, usually stays alive for just 12 to 24 hours. So if you're having sex just once within the fertile window, your chances of conception is going to be lesser than for those who have more frequent sex. So basically, it is important that you balance your sex life within the fertile window. Instead of having sex like 5 times a day, you can ensure that you're having once a day or once every other day within the fertile window. This way, you'll be able to maintain your energy, you'll be able to avoid stress, and you'll also increase your chances of pleasurable sex and also chances of getting pregnant. The number 2 reason you're not getting pregnant is stress. Now, a lot of people get stressed out during the process of trying to conceive. For the fact that you've tried 1 month, 2 months, 3 months, you could get stressed out. And stress can be from your job, it can be from household chores, and it can be from other things. So ensure you avoid stress within your period of trying. That way, you're going to increase your chances of getting pregnant. Now, the number 3 is the man factor, and that has to do with the sperm count. Now, having a sperm count that is not optimum is going to affect the chances of conception per cycle. If you have a low sperm count, poor sperm qualities, poor sperm motility, poor sperm morphology, it is definitely going to be affecting the chances of conception. So if you're a man and you are having difficulty with your partner conceiving, you can consider having a sperm analysis done so that your sperms are checked for quality and also motility. So the next reason you're not getting pregnant is running to clean up immediately after sexual contact. A lot of people believe that sexual contact is messy, so as soon as the man ejaculates, the woman just jumps out, rushes into the bathroom to begin to wash, just to make sure that she feels fresh. But it is always important or better to lie at least for a few minutes after sex to ensure that more of the sperm makes their way into the womb before you go to clean up. So cleaning up immediately after sex can actually decrease your chances of getting more sperm into the womb and then reduce your chances of conception in that particular cycle. Lying down for some time after sex may actually help you get more sperm into the womb to increase your chances of getting pregnant. The next reason you are not getting pregnant is that you're sleeping less. Now, adequate sleep helps relax the body and help it function optimally, and it has been proven to help with maintaining high level of fertility. So if you're someone who do not sleep, maybe because of job or maybe due to circumstances of life, you're stressed up, you cannot sleep, please make sure you work on your sleep pattern. That is going to help increase your fertility and also help you relax and increase your chances of getting pregnant. So number 6 is use of tight undergarment. Now, excessive use of tight undergarment has been shown to reduce quality sperm production in men, and also for women. If you continue to use tight undergarment, it will expose the vagina to infections, and once there is infection, that is going to reduce your chances of being fertile and your chances of conceiving, because this infection can spread to other reproductive organs and cause you to have pelvic inflammatory disease, and once this happens, your chances of conception is going to be greatly reduced. So you reduce your use of tight undergarments. Number 7 is being overweight or underweight. Now, having excessive weight or too little weight is not good if you are trying to conceive. So make sure that you maintain an optimum body mass index. This is going to help increase your chances of conception. So if you're trying to conceive, make sure you work on your weight. You can exercise, you can work on your diet to make sure that you get that optimum weight that is going to aid your getting pregnant. The next reason is excessive use of lubricants. Now, there are lubricants that have been proven to interfere with sperm motility. Some lubricants have acidic pH and this kills sperm cells. Use of certain lubricant and using it excessively can actually reduce your chances of getting pregnant. Number 9 is poor lifestyle choices. Now, poor lifestyle choices such as smoking, drinking of alcohol, use of drugs such as marijuana, cocaine can actually impact your ability to get pregnant. And even if the man is the one engaged in this, these activities are going to destroy the sperm production, sperm quality, and also affect erection and ejaculation, and this is going to impair pregnancy. If you are engaging in dangerous lifestyle habits, you make sure to change if you're going to actually try to conceive. Number 10 is environmental pollution. Now, exposure to harmful chemicals such as pesticides, insecticides, and other environmental pollutions and hazards are going to impair your ability to get pregnant. You could also expose yourself to radiations. Now, having X-ray once in a while is not a problem, but if you begin to expose yourself to radioactive waves, ultraviolet waves for a long period of time, it is actually going to affect your fertility and reduce your chances of getting pregnant. Number 11 is irregular period. Now, people with irregular periods are believed actually to not ovulate all the time, and this is a proven fact. So if you have irregular period, there are chances that you might not be ovulating all the time, and even if you're ovulating, you're going to have difficulty actually calculating this ovulation, and so it's going to affect your ability to get pregnant. So irregular period is also one of the reasons you're not getting pregnant. Number 12 is endometriosis. Now, endometriosis is a condition where the tissue that line the uterus actually grow into other organs. They could grow into the cervix, into the tubes, and this is going to make it more difficult to get pregnant because this tissue can cover the cervix and prevent sperm from entering the womb. They can cover the tubes and prevent sperm from climbing up to fertilize the egg. And once this happens, it's going to reduce your chances of getting pregnant. So endometriosis is also one of the reasons you might not be getting pregnant. The other reason is ovulation problem. Now, if you have anovulation, a condition whereby you're not ovulating due to several factors, you might have difficulty conceiving because once there is no egg being released monthly, the chances of conception is going to be very low. So ovulation is believed to actually contribute to about 40 to 50% of infertility. So one of the reasons you might not be getting pregnant might be that you're not ovulating, and you should talk to your doctor about it. Number 14 is PID and other STDs. Now, PID is pelvic inflammatory disease. If you have PID, it is going to affect your chances of getting pregnant because sometimes when you have inflammation in your tubes and inflammation resolves, scar tissues are formed, and this can prevent sperm from getting access to the egg. And sometimes even when the egg is fertilized, they find it difficult to come and implant in the womb because there is no much space for them to pass, and this can result to ectopic pregnancy. So untreated infections can actually lead to pelvic inflammatory disease. Infections like chlamydia, gonorrhea, trichomonas, candidiasis, if all of these infections are not treated, they can lead to severe consequences, and this can affect your ability to conceive. This has to do with both men and women. Chlamydia, gonorrhea, all of these infections can affect both men and women. So if the man is not treating, it's going to affect the quality of sperm, quantity of sperm, and the rest, and also the woman as well. So make sure that you treat infections as soon as you notice them to prevent all of this kind of consequences. Number 16 is tubal factor. Now, there are women who have tubal blockage or damage to their tubes due to maybe surgery. Maybe you've had surgery on the tube before, or you had an infection like I said earlier. PID can actually cause blockage of your tube if it is not treated after a long period of time. So tubal blockage is also one of the reasons you might not be getting pregnant. So make sure that you talk to your doctor or get examinations done so that interventions are given to you. In most cases with tubal blockage, it is extremely difficult to actually get pregnant, but intervention can actually be given if diagnosed early. Number 17 is egg quality. Now, egg quality declines with age. So you notice that as you are getting older, the quality of your egg is diminishing, and so your ability to conceive is also going to reduce. You might begin to have more difficulty getting pregnant because of the quality of your egg, and also chances of us also having babies with chromosomal abnormalities also increase as you age, because of course the quality of your egg is not going to be the same as it was when you were younger. So this can also affect your ability to conceive. Number 18 is low progesterone levels. Now, progesterone is meant to maintain pregnancy. So if you have low progesterone level, you might be losing pregnancies even before you know it, because there is not enough progesterone to maintain a fertilized embryo that have just implanted, and so you could be losing pregnancy very early, and this is going to definitely affect your ability to maintain a pregnancy. Number 19 is change in the cervical mucus. Now, the slippery egg white-like cervical mucus that we get during ovulation is to help propel the sperm and aid its movement up through the cervix to meet the egg during ovulation. If there is a change in the texture of the cervical mucus, it is going to affect the movement of the sperm, and once this happens, getting the sperm through the cervix to meet the egg is going to be impaired. And if the cervical mucus also change to a very acidic level, acidic pH, it is also going to affect the survival of the sperm. Number 20 is blockage in the epididymis. Now, epididymis is the tube that carries sperm from the testes and upward through the vas deferens to the urethra, where it is released. Now, if there is blockage in this tube, it is going to affect sperm release even after production, and this is going to affect a woman's ability to get pregnant, because of course the partner is not going to be able to release sperm. So this is going to affect ability of a couple to get pregnant. But 21 is unexplained infertility. Now, there are infertility that do not have origin. You do the entire test, everything is normal, seminal analysis are normal, every single thing is normal with both the man and the woman, but pregnancy is not happening. In this case, this infertility cannot be explained, and it is not just your fault. All you need to do is continue to try, and before you know it, you might just get pregnant and have your babies. The last one is combined infertility. Now, this is when there is issue with both the man and the woman. The woman can be having an ovulation or irregular periods, and then the man is having low sperm count, low sperm quality, and the rest of them. Now, when this happens, it is going to affect the ability of this couple to get pregnant. Now, this is the 22 reasons why you might not have been able to get pregnant. So if you have found yourself in any of this situation, make sure you report to your healthcare provider for onward test and intervention to increase your chances of getting pregnant. If you found value in this video and you've not liked it at this point, please hit the like button and subscribe if you've also not done it at this point. Thank you so much for watching. I'll see you again in the next video. Bye.